very short opening remark, after which the quizmasters are going to take over and read out the rules and do the roll call for the MSAs present. Miss Director, please, you have the microphone.
Good afternoon, everybody, ladies and gentlemen, distinguished quiz members from all the 6 finalists of MSAs present here today, the Chief of Staff, Emerging Leaders Forum, MSA President here present, members of the Executive Committee, the regional directors and coordinators for Emerging Leaders Forum here present, members of MSAs here to support their teams, and recognizing our special guest for today in absentia, in person of Dr. Umar Muhammad Nambuba, the 44th NIMSA President, Ibrahim Muhammad Bello, the Pioneer Chairman for the NIMSA Emerging Leaders Forum, and Toro Bong Obot, the immediate past National Director for the NIMSA ELF, formerly known as the Preclinical Forum. You're all highly welcome. And I must say it's an exciting end to a journey that we started quite a few days ago, or rather, I would say a few days ago for the participants, and weeks of planning for the executive team, most especially the Chief of Staff of the NIMSA Emerging Leaders Forum. But well, finally, here we are. It's been a lovely journey from a battle of about 38 medical students associations in the country, over 114 participants, 6 regions, and finally the grand finale, the nationals, where we have 6 regional champions from 6 MSAs and over 18 participants. First and foremost, congratulations to you all. To all of the 6 MSAs that have made it thus far, you have come a long way. This is coming from knockout rounds and stages where you've competed against excellent MSAs within your regions and successfully emerged as the regional champions. You all are winners. And now we're finally here to crown the national champions in the Preclinical Quiz Competition's Tough Banter for the 3rd edition. I wish you the very best of luck. You've displayed an amazing array of stuff so far. And well, this is the final dance, so to speak. And good luck. Please, as a word of advice to you all, stay calm, stay collected, participate and play by the rules of the game. So we would enjoy this competition to the most of its limits, and most especially, good luck. For all of the previous competitions, I have concluded with saying, may the MSA with the most stuff win. But I think I said adjusting it towards the last one, and now I would go with, may the MSA with the most stuff and the most luck win. I'm excited to see what you're going to do here today. So to our final 6, Federal University Braining Kebbi Fubimsa from the Northwest, University of Ibadan Medical Students Association from the Southwest, Abubakar Tafawa Balewa University Medical Students Association from the Northeast, Chukwuemeka Combs, I'm so sorry, I tend to have an issue pronouncing the full MSA from the Southeast, and finally Ambrose Ali University from the South. I wish you the very best of luck. I remain yours, Aisha Lambata, the National Director for the NIMSA Emerging Leaders Forum, and it has been an amazing ride with you all, and I wish you the best of luck.
All right, thank you very much, Madam National Director. Okay, so we'll be moving ahead to introduce our quizmasters for today. In person of Abdul Hakim from Olabisi Onabanjo University Medical Students Association, and Khadija Garba Muhammad. I believe the both of them are on the call right now. So please, quizmasters, if you can hear me, you can start sharing your screen. Once more, let's go over the rules of the competition. We would like to ensure that all the participating MSAs have their videos on. Please, if you do not have it on, kindly turn on your videos now. In the case that you have 3 people using one camera, kindly place the camera far away enough for us to see all 3 participants. Thank you. And okay, we are also going to be having the same rounds, anatomy and biology, 2 rounds of anatomy, 1 of biology, 2 rounds of physiology, 1 of physics, 2 rounds of biochemistry, 1 of chemistry, and then 1 round each for NIMSA knowledge and the Nigerian general current affairs. please let's ensure that we do not, as audiences, let's ensure that we do not send any messages to the chat box while the quiz is going on. If you have any observations, you can raise your hands and then to be addressed after that particular round. Thank you for joining us once again. And yes, our audiences, you are our eyes, you are our observers. Please keep an eye on the videos of the participants, as we might miss some things, and just to ensure that everything is going smoothly. And if in the event that you observe anything, just raise your hand and then our attention will come to you. Thank you very much. So yes, over to the quiz masters now.
Good afternoon. Can anybody hear me?
Yes, we can hear you and we can see you as well.
Okay, yeah, good afternoon. My name is Abdulhakeem from OUMSA. I'll be the quiz master for today's final for Stop at 2.0. Yeah, so I'll be going over the rules of the quiz again, and it's the same as we have done it from the round to the second round down to the finals, which is the national. Yes, we'll be having different questions from different sections, from anatomy, biochemistry, physiology, physics, chemistry, biology, current affairs, and IMSA questions. We'll be having two rounds each for anatomy, biochemistry, and physiology. And we're having one round each for physics, chemistry, biology, current affairs, and IMSA questions. At any point where each participating school had to answer their questions, like Dr. Hanifa said, 3 of the participants must be seen on the screen. That is, all MSAs must put their videos on. And I want to see all the 3 participants on the screen. In any case, if they deviate from the last 2, you automatically be disqualified. But before that, I will deduct your points if at any point, if I did not see 3 of the participants on the screen while attempting the questions. And the questions for this final are all multiple choice questions. That means that you only have, each participating school just have only one attempt to answer those questions. And you only be given 10 seconds to answer. I repeat myself again, all participating schools just have one attempt to answer their questions. Anything more than one attempt will not be accepted. So I hope all the participating schools get that. And finally, the quizmaster's decision is final. I'll be handing over to my co-quizmaster. Please take over for me while I work on sharing my screen. Thank you. Dr. Hanifa, the second quizmaster. I'll go ahead to introduce himself.
I believe she's here with us, but maybe she's having network issues and unable to speak right now. But I believe she's here with us. Please kindly mute your microphone yeah, thank you very much. Please let us all ensure that our microphones are muted, except the MSA that is responding to the question at the time. Thank you very much once again. Please, your video should be on. This is the last round. This is the grand finale. Any of the, should I say, excuses we have been tolerating since the beginning, we would not be tolerating that today, just as the quizmaster has said. So please ensure that your videos are on so you do not get disqualified or penalized. Thank you very much.
Hello everyone. Can you hear me?
Yes, we can hear you.
All right. Good afternoon to you all, and welcome to the National Banter Quiz for the Preclinicals. And I wish all the best for all the other MSCs. My name is Khadija Garba Muhammad. I'm one of the quiz masters, and I will be responsible for timekeeping and also recording your scores. And I will also want to advise all the other MSCs that please during this quiz ensure that you have harmony before you answer your questions, and make sure your final answer you said it within the 10 seconds given, as there will be no single second that will be added to any MSC, and lack of harmony will cost you 0 mark at the end of the time. So thank you, and I wish you all the best.
Thank you very much, ma'am. Okay.
Hello. Can you hear me?
Yes, you can speak now.
Okay, and one thing again, that it is 1 attempt per question, please. Any attempt apart from that, it will be disregarded as 0 marks. So I'll record it as 0. So please ensure that you have harmony before you answer, and it is only 1 attempt. Thank you.
No, they're not. And Jordan, login, so we not to go on login. Link it to resume. Inside your technique or the password. Hello, please. Hello, good afternoon, everyone. Please, can everybody see my screen?
Yes, I can
Yes, yes, we can see your screen.
Yes, we can see your screen. We project the slide.
Yes, we can see it.
All right. Thank you. Please, can anybody see the screen?
Yes,
Yes,
we
sir.
can, sir.
Okay. Please,
Sorry,
what do you
it's
see on the
Khadija. Can I
screen?
say something?
Yeah, you can. Yeah, you can.
Okay, my observation is that some of the MSc, their participants are either I can only see two of them logging at different time. Is it that because they are not at the same place or what? Being three of them at a place will help us monitor much better.
Yeah,
Okay. Yeah,
unfortunately, some participants are at home while others are in school and places like that. So that's why they have to join separately.
All right, no problem.
okay, please, can anybody tell me what you are seeing on the screen, please? I want to be sure everybody is seeing it.
All right, we can see the files. We can
Yes,
see the
we can see.
anatomy grand final, biochemistry grand final, biology grand final, and current affairs, physiology, physics, NIMSA affairs, and stuff, I
Yeah,
think. So yes, that's
oh,
what we can see on the screen.
that's all you can see on this. Oh, okay. All right.
Yeah, precious is Abi. Just drop this name. I want you to get something from this.
Sir, number one, please could you mute yourself? I'm not sure you're aware that you're muted. All right. Quizmaster, sir, we are waiting for you. If there is issues with the screen presentation, maybe you could stop sharing and then reshare the screen. Maybe that would help correct anything. Please, let's all have some patience while the Quizmaster sorts this out.
Hello, Quizmaster, sir.
Hello, yeah, I can hear you. I can hear you.
All right. So I have a suggestion that we also applied during the last regional quiz, the last one we did, about if any MSA is being detected for any case of malpractice or something, that question will be disqualified and they will be scored 0, and also they will be subtracted 5 marks from their previous score. So I don't know what you see about that.
Please, can you please come again?
I was saying that like any MSA that is being detected for any form of malpractice or suspiciousness, when they answer the question, that question will be scored 0, and also 5 marks will be subtracted from their previous scores. So I don't know what you say about it. Can we do like that also?
Yes. If I've seen that there's concrete evidence, or probably have given them a prior warning. The first
Okay.
thing I'll do is to subtract the 5 marks. Then the second time they do it, they will be automatically disqualified.
All right.
How wrong is this?
So I hope the audience had this very clearly.
All right, Quizmaster, sir, I think we would have to disqualify the first 3 questions of anatomy because it has been on the screen, and even myself, I could read them from the sidebar.
Okay, all right.
Thank you.
Thank you. That's what I was trying to sort. Yeah, that's what I was trying to sort, so that people will not see the questions before I read them out. All right, thank you. So I want to do the roll call for the participating schools. I'll be starting. The number of schools I have here is 6. So University of Ibadan MSA, can you please signify that you are here from Southwest?
Present. Sorry, sir, we can't hear you.
Okay, I can see you. I want to see the 3 of you. Okay. Abubakar Tafawa Balewa University.
We are here.
From Northeast. Okay, the 3 of you are here. Federal University of Benin Kebbi.
We are here.
We are here. We are here.
I'm only seeing just one. Okay, and the other 2 participants. Okay.
Yes.
I want to say that if either of you have to answer the questions,
Sorry, sir, we can't hear you well.
that if your school must answer the question, it must be either the 2 of you or the other person that is in the other location that must answer. The 3 of you can't answer at the same time because you are in different locations.
We are aware of
Okay,
that.
all right, I'm trying to say.
Oh, yeah.
Okay,
We
all
are
right.
aware of that.
University of Abuja. University of Abuja MSA.
Present, sir.
Okay. Chukwuemeka Agumedi University. Chukwu, I'm only saying two of you. Where is the third participant? Where is the third participant?
He's here.
Yeah, I'm only saying the two of you now.
Yes, sir.
Huh?
Yes, sir. Yes, sir.
And where is the third participant?
He's here. He's here. Malaki indicates.
And now I'm only saying the two of you on the screen.
I'm here, sir. I'm here. I'm on
Yes.
the video.
He's Komsa Victor. He's Komsa Victor. He's hello.
I'm here. I'm here. Don't you hear me? I'm on another screen. I'm on a split screen.
Okay. Okay. I've seen then Ambrose Ali University. Yakuma.
Present, sir.
Present, sir.
Present, sir.
Okay, all right. Noted. We'll be starting soon. Note number 1 to 3 have already been removed. So you have numbers 4 to 20 to pick from and be going around. You just hold on a minute.
Here you go.
Mr. Quizmaster, if you are here with us, we can no longer see your screen.
Yes, Dr. Anifat, I want to make sure that what happened the last time did not happen by people seeing the question. So I want to make sure that that is sorted. It's apologies to the participants. So I want to sort that so I won't be having those issues. So that we will have a smooth flow. So,
All right, thank you very much. As the Quizmaster is sorting that out, please, we apologize for the delay, and thank you for waiting with us, for being patient. Before he comes back, I would like to recognize the presence of the pioneer chairman of the Emerging Leaders Forum in person of Ibrahim Muhammad Bello, who has just joined us, and then the immediate past national director for the Emerging Leaders Forum as well, in person of Torobong Obot. She also just joined us. You're welcome. You're welcome, sir. You're welcome, ma. We're glad to have you, and we're very honored to have you here as well. Okay, sir. Sir Ibrahim Bello, if you are able to speak, could you please give a very short goodwill message to our participants before the Quizmaster comes back?
Hello everyone. Please, can you hear me?
Yes,
Hello.
we can hear you.
Okay, I have
We can hear
a
you,
little
ma'am.
bit concern with the Ambrose Ali University Medical Student Association because I can only see two participants, and again, you have to tell us which among you will be answering so that there will be no mix up in a case where one participant says another answer and the other one disagree with that, so that we will know whose answer to be taken. So can you please specify?
Miss Quizmaster, the Ambrose Ali situation, they have only two participants for the competition, and
Okay.
that has been, yes. So Ambrose Ali, please. Okay, Ambrose Ali, please specify as the Quizmaster has said.
Your question's so good. I gotta put this one. I want to talk about that questions.
Okay, sorry for the delay and the technical error. You know, it's all in the purpose for all because of sharing. Please again, I'm emphasizing, I want to see all the MSAs and their participants on the screen right now. I want to see all the MSAs that are participants on the screen. I'm only seeing Chukwuemeka Odumedu and Abubakar Tafawa Balewa. I'm not seeing UI MSA on my screen. I'm not seeing University of Abuja MSA on my screen. And I'm not seeing Federal University of Benin KB on my screen right now.
Yeah, on the screen.
Okay, that's fine. So we'll be starting with University of Ibadan
So please, we
MSA.
can't hear you clearly.
I say you'll be starting.
We can't hear you clearly.
Your line is broken.
Hear you clearly. Your
Sincerely,
line
we cannot hear you.
I don't hear you, sir.
Can you hear me now? Can you hear me now?
It's still low. That's why we have to even shift the screen forward.
Okay, can you hear me now?
Yeah, it's a bit better.
Yes.
Can you hear me? Are you hearing me louder now?
Yeah, it's a bit better. Yes, sir.
Yes.
A bit better. Okay, so from number 4 to 20, please pick your number.
Question 7.
Question 7. Okay. Okay, hope you are seeing the screen right now.
Yes, sir.
Okay, the question goes thus. What is the NAV root value of the external urethral sphincter? A, S4, B, S1, S2, S3, C, S2, S3, S4, D, L3, L4, L5, E, L5, S1, S2. What's your answer? UIMSC, I'm waiting 10 seconds.
A, S4.
S4. Okay, that's 1 out of 10. Yeah, and you are wrong. The answer is C. S2, S3, S4. That's the answer. So 0 points to the University of Ibadan.
All right.
What? That's what we said now. Sir?
So you said
A.
S4. That's what I heard. Hello?
No, we can't hear you. We said A, S4.
And I said you are wrong, that the answer is C. That the answer is C, S2, S3, S4.
Hello? Read the ones.
Hello? You are
Yes, sir.
wrong with your network. I said the answer is C, that you are wrong. It's S2, S3, S4. UI. Please, we'll be moving on to the next school, please. Abubakar Tafawa Balewa University, your question.
Question 10.
Question 10. Okay. Okay. So question 10. Please, 11 has been ruled out. On examination, of the inferior and lateral to the pubic tubercle, which aids the diagnosis of a femoral hernia. Therefore, part of Julius bowel had entered the femoral canal, which causes a bulge into the femoral triangle. An anatomical region in the upper thigh, lateral to medially. What contents can be found in the anatomic region? That is, the contents of the femoral triangle from lateral to medial. A, femoral nerve, femoral artery, femoral vein, empty space lymphatics. B, femoral artery, femoral vein, femoral nerve, empty space lymphatics. C, femoral nerve, femoral vein, femoral artery, empty space lymphatics. D, lymphatics, empty space, femoral vein, femoral artery, and femoral nerve. Abubakar Tafawa Balewa, 1 attempt and you have 2 questions.
The answer is A.
The answer is what?
It's A. Femoral nerve, femoral artery, femoral vein, empty space, and lymphatics.
Time up, time up.
That's correct. They said the answer before the time was up. So 4 points to Abubakar Tafawa Balewa University. Okay, Federal University of Benin Kebbi. A question.
Question 5.
Question 5. Okay. A 40-year-old lady presents to the emergency department with a sudden onset of left-sided painless facial weakness, as well as a drooping mouth and difficulty speaking. She tells you she's worried that she's having a stroke, and you find that she has no significant past medical history. After further investigation, you're able to rule out a stroke and suspect that the patient may have Bell's palsy and idiopathic paralysis of the facial nerve. Which of these symptoms do you expect to find on examination? A, taste impairment of the anterior tongue. B, symmetrical forehead movement. C, bilateral ptosis. D, increased tear production. You have 10 seconds to answer.
A, taste impairment. A, taste impairment of the anterior tongue.
Yeah, taste impairment of the anterior tongue is correct. 4 points to Abubakar Tafawa Balewa University. University of
Federal
Abuja,
University.
MSA.
Federal University, Kebbi.
Federal University, sorry. University of Abuja, MSA, your question. University of Abuja. University of Abuja, MSA.
Question 9. Question 9.
I'm not seeing you on the screen.
You answer, we cannot see your video, please.
Can we use different channel?
University of Abuja, I can't see you on the screen.
What's the video? This one is not showing video. Hello?
Hello, we can't see you on the screen.
They can't see us.
We are putting on the video.
University of Abuja, how many points are you collecting from, please?
Please, can you please, if you have 2 connections in the same place, it won't work. Okay. University of Abuja, I'm still not seeing you.
Oh, I'm trying to sort that out. It's network.
University of
Okay. Can you please unmute yourself?
University of and connect
Yes.
device from
Please unmute yourself.
So we are here.
University of Abuja, please, before we move ahead, I can see that you have 2 phones in one location.
Please
Please
don't use 2
ensure
phones in
that
one location. Just use one. Please.
ensure
That's
that
why
the
it's
other
causing the
speaker
echo.
of the other phone is off and the microphone, so you do not echo. The echo is disrupting the flow of this event, please. So please turn off the speaker and the microphone of the other phone while you use this one phone to answer the questions. And also, please keep the phone still in front of you so we can see you. Stop moving the phone around. Thank you as you sort that out.
So University of Abuja, I'm not seeing anybody from University of Abuja.
So University of Abuja, we are using this channel now.
We can see.
The only people I'm seeing on the screen, I'm seeing Chukwuemeka Odumegwu, I'm seeing Ambrose Ali University too, I'm seeing Aboka Tafawa Balewa, I'm seeing contender from Federal University Benin Kebbi, and the other person from Federal University Benin Kebbi. And I'm seeing people from Ambrose Ali 1, the University of Ibadan MSA 2. I'm still not seeing anybody from UMSA on my screen.
Our quizmaster can see the 3 participants from University of Abuja.
Present, please.
Okay, all right.
Wonderful.
Okay, so University of Abuja, your question.
Question 7.
Question 7, okay.
Question
It has
7
been
has
picked.
been answered.
It has been picked. Please,
What?
another question.
9. Question 9.
Okay. A 23-year-old man was stabbed in the chest, approximately 10 centimeters below the right nipple. In the emergency department, a abdominal ultrasound scan shows a large amount of intraperitoneal blood. Which one of the following statements relating to the likely site of injury is untrue? A. Part of its posterior surface is devoid of the peritoneum. B. The caudate lobe is contained within the functional right lobe. C. Its nerve supply is from the celiac plexus. D. The hepatic flexure of the colon lies posterior inferiorly. E. The right kidney is closely related posteriorly. You have 10 seconds to answer.
D.
7 seconds now.
D.
Okay, D. Okay, yeah, wrong. The answer is A. It is the bare area of the liver. The answer is A. Part of the posterior surface is devoid of the peritoneum. So no points to University of Abuja MSA. Chukwuemeka Odumegwu University, your question.
Question 4.
Question what?
Question 4.
Question 4. I'm only seeing just 2 of you on the screen.
I'm here on
Can
a
you
different
say something now?
device.
Okay. Stensis duct open at A. Upper third molar teeth. B. Upper first molar teeth. C. Upper second molar teeth. D. The upper first premolar teeth. 10 seconds.
Let's go with A.
Time up.
C.
You first said A before C.
Yes, and the time was up.
And the time was up. So I won't be giving any point.
We chose one answer first before the time went up. We chose one answer first.
And you said A. I heard you say A before you now said C. And I told you that the questions are only one for one attempt. They're only for one attempt.
we chose C before we said A. Before he now said time up.
No, I had A before C. C was the last option you picked. So 0 points to Chukwuemeka Odumegwu University. So Ambrose Ali University, your question. Ambrose Ali University. We are waiting for you now.
Question number 11.
Question what?
Number 11.
Okay.
11 is taken, Quizmaster.
11. No, 11 has been picked or was just removed because it has been shown on the screen. So another number.
Question 13.
Question what?
13.
18,
1,
right?
3, 13.
13.
13. 1, 3.
All right. A 28-week pregnant 27-year-old is informed that her antenatal ultrasound and a subsequent MRI have shown that her baby has hypoplasia of the cerebellar vermis. The baby is diagnosed with Dandy-Walker syndrome. The neurologist explains to the mother that embryologically the brain is formed from various swelling or vesicles of the neural tube, which itself becomes the central nervous system. Which embryological vesicle has failed to develop in our baby? A. Prosencephalon, B. Metacephalon, C. Myelencephalon, and D. Diencephalon. 10 seconds.
Metencephalon. B.
Okay, option B is correct. 4 points.
B.
What did you say?
B.
Yeah, that's what I said. I said B. I said option B is correct. So 4 points to Ambrose Ali University. Okay, we'll be starting with UI for the second round of questions. Question what?
15.
15.
Which MSA is going now?
UI MSA. Please sort your collection.
Question 15.
Question 15. Okay. A 6-month-old child is brought to the surgical clinic because of non-descendant test. What is the main structure that determines the descent part of the testicle? A. Cremaster, B. The mesochium, C. Inguinal canal, D. The gubernaculum. UIMSA.
Inguinal canal.
Inguinal canal, that's wrong. The answer is D. The gubernaculum.
Fuck. The question was not clear. Fuck.
The question was not clear. You are seeing the question on your screen. You read it out as I read it out. The different part of the testicle. So 0 points to University of Ibadan MSA. So Abubakar Tafawa Balewa University. Your question.
5.
Question what?
5.
5 has been picked.
8.
What did you say?
8.
8. Okay. A 78-year-old man is undergoing a femoral popliteal bypass graft. The operation is not progressing well and the surgeon is complaining of poor access. Retraction of the following structures will improve access to the femoral artery in the groin. A. Quadriceps, B. Adductor longus, C. Adductor magnus, D. Pectineus muscle, E. Sartorius. 10 seconds. Going.
D. Adductor longus.
Wrong. The answer is E. The sartorius muscle. 0 points to Abubakar Tafawa Balewa University. Federal University of Benin Kebbi. Your question.
Question 20.
Question 20. Okay. Which one of the following structures does not pass behind the piriformis muscle in the greater sciatic foramen? A. Sciatic nerve. B. Posterior cutaneous nerve of the thigh. C. Inferior gluteal artery. D. Obturator nerve. E. None of the above.
D.
What did you say?
D. Obturator nerve.
The obturator nerve is correct. 4 points to Abubakar. Sorry, 4 points to Federal University of Benin Kebbi. So, University of Abuja, MSA. What?
19.
Your video just disappeared right now. University of Abuja.
Here we are now.
We can see their video now, sir. Quizmaster.
Question 19. Question 19, right?
Yes, they chose 19. Okay, I think the quizmaster just left the call. Hopefully, he's going to present his screen back. Mr. Quizmaster, if you are still here, if you can hear me, we cannot no longer see your screen.
Sorry for the delays due to network. I'm coming.
We cannot hear you, sir.
Okay, hello. Hello, can you hear me now?
Yeah, we
Yes,
can.
we can hear you.
Okay, so University of Abuja, your question number 19. The epidural hematoma is most likely due to a rupture of the middle meningeal artery. Which one of the following structures does the artery pass through before supplying the dural matter? A. Foramen magnum. B. Stylomastoid foramen. C. Foramen ovale. D. Foramen spinosum. 10 seconds.
D. Foramen spinosum.
The foramen spinosum is correct. 4 points to your Then Chukwuemeka
Good.
Ogumegu.
Excuse me, Quizmaster.
Yeah.
Okay. We just got. It just.
I can't hear
Okay,
you.
let me just go direct to the point. Let's see, because they have an exam. Can you hear me now, sir?
Yeah, I can hear you. I can hear you.
Okay, so I said UIMSA has to leave by 4:30 for an exam in their school, and they are going to have to remove 2 participants to go for the exams. And I do not think that would be fair to go ahead with just 1 person. So the suggestion the national director is giving is that we allow UIMSA answer all their questions from all the sections, and then they can leave.
Okay. All right, no problem.
Okay.
That
So
would be okay.
I think Kumsa is the next. Please, Kumsa, Aumsa, Fubimsa, Atbumsa, and Yuamsa. We are sorry. We have to allow UIMSA go ahead with their own sections while you wait, and then we resume for you guys after they are done. We are so sorry for the inconveniences. We are really, really, really sorry. Thank you very much.
Okay, all right. Okay, so you will be moving to physiology next, University of Ibadan. So that to allow me to share my screen for that.
Apologies once again to the remaining 5 MSAs that have made it to the finals. As we're all medical students, I'm sure we understand the nature of tests and exams that can pop up at unscheduled times within our MSAs. And sadly, that is a situation that we have with UIMSA. So just to clarify, UIMSA will be taking all of their questions. That means they'll be taking their 2 questions from physiology, 1 from physics, 2 questions from biochemistry, 1 from chemistry, 1 question from biology, there 1 question from NIMSA, and 1 question from current affairs. This will be done in the view of all members of the audience to ensure transparency. It's an unconventional solution, but it is the only way that we can allow our colleagues and fellow medical students to make it out in time to write their exams, while also not disenfranchising them or discrediting them from participating in a competition that they have rightfully earned spots in the final. We sincerely apologize to all MSA presidents here present, all members of the quiz teams of the remaining 5 MSAs, and all members of the audience, and also to our quiz masters for the disruption. It was an unforeseen circumstance, and sadly, we have no option but to do our best. Thank you. We encourage the remaining quiz team members of the other MSAs to please stay behind and watch. This is so that you will understand that it is a completely transparent process with regards to the questioning for UIMSA. Thank you.
Quizmaster, sir, you have the floor. Thank you very much, Madam National Director.
Okay, all right. University of Ibadan, MSA. Can you hear me?
Yes, sir.
Technology, you have from question 1 to 20. You are just having 2 rounds. So pick your question.
Question 7.
Okay, a 34-year-old man presented to the emergency department 2 days ago with severe hypocalcemia and has been given calcium replacement. However, his hypocalcemia remains refractory to treatment. Which other serum electrolyte is it most important to check? A, B, potassium, C, sodium, D, chloride, and E, magnesium. UI, MSA.
Magnesium.
Magnesium is correct. And 4 points to you. So your second question.
Question 6.
Question 6. What step is essential for the formation of all steroid hormone? A, conversion of cholesterol to pregnenolone. B, conversion of cholesterol to progesterone. C, conversion of cholesterol to prednisolone. D, conversion of progesterone to pregnenolone.
A.
A for apple. A for apple is correct. 2 points to you. You'll be moving to biochemistry now.
Right answer.
Yeah, they picked the right answer. A is correct.
All
So
right.
they got their 2 questions right to physiology. You are going to biochemistry right now. Okay. University of Ibadan, MSA, Biochemistry. Your
Question
question, what to
15.
20? Question what?
15. 15.
15. Okay. Increased serum iron and decreased iron binding capacity are found in that A. Iron deficiency anemia, B. Sideroblastic anemia, C. Thalassemia, D. Anemia of chronic disorders. University of Ibadan, your time is going, single attempt.
C.
Time up.
Okay, your
We
time
said
is up. Yeah, your time was up before you mentioned C. Your time was up before you mentioned
I said it before the time. So our network is not good.
And I've told you repeatedly that you should check your connection. Now I've been complaining.
Yeah, we said it before she said time up. I'm that one. You can confirm the audience.
UI's answer came in a single second practically before the time was called. Sorry for the interruption.
Right, 4 points to University of Ibadan, MSA. Your other question.
Question 9.
All right.
The formal question.
Yeah, their last question for BCA. Okay, so 9. Are you listening? University of Ibadan. UIMSA. Dr. Anif, I guess their network is still a challenge, and I don't know how we can continue. I will pause the whole program for them right now to go and have the exam.
I'm sorry, sir. I think this question, they can no longer take it. It has been displayed for a longer time.
And then they have to pick another one.
Yes.
They are not back online yet.
Okay, I'll contact them off the call and please let's give them a few minutes. Okay, I believe we have another representative from UIMSA on the call. Please contact your participants and tell them we are waiting for them.
Are they back? I'm seeing UIMSA too.
Yes, we are back on the line.
All right, so pick another number. 9 has been cancelled.
Question 8.
All right. Which of the following contributes nitrogen atoms to both purine and pyrimidine rings? A. Aspartate, B. Carbamyl phosphate, C. CO2, D. Glutamine.
B. Glutamine.
What did you say?
Time
You
off.
said glutamine.
Time off.
Yes, he said glutamine.
Yeah, glutamine is wrong. The answer is A. Aspartate. So we have 0 points for that question. We'll be going to physics.
I guys ready. They're not talking.
So UIMSA, just have one round of questions for physics. Go ahead. What's 1 to 10?
Question 4.
Your network is at
Question 4. 4.
all right. In a dot interference pattern, if the pattern is different between the two waves, it has a wavelength. What type of interference? A. Constructive interference, B. Distortive interference, C. Partial interference, D. No interference. 10 seconds.
Time off. Time off.
B. Destructive. Let B. What's happening? I know network is not. B. Destructive. Is that B. Destructive?
Timekeeper.
No, we can't hear.
Time off.
Timekeeper. And do you count the time immediately after I read the question, or
It was
too fast now.
It was almost 12 seconds before the queen answered the question.
no, I think it's best
No,
if you start
no.
counting it immediately after I finish the question.
Yes, after you finish reading the questions, when you started the options.
No.
Okay, no, we didn't know it
the
like
options. Reading out the option is also part of the question.
It's part of the question now.
It's part of the question. I will give them the amount because they got it. But I think since going on for now, you start counting immediately after I finish the last option.
All right.
Okay, all right. Thank you. So we're going to chemistry.
Did we get it? We got it.
So, UI, chemistry, 1 to 10.
Question 9. Question 9.
Okay. How does common salt help in separating it from the solution after saponification? A, by decreasing the temperature of soap. B, by increasing the solubility of soap. C, by increasing the density of soap. D, by increasing the solubility of
B for ball. By the
soap.
president. B for ball.
B for ball. Okay, correct. 4 to UI.
I think that B for ball is okay.
So we'll be going to biology next. Okay, so biology 1 to 10.
Question 6.
Question 6. Charles matter affect including A, lecithin, B, package, C, zygotin, D, diplotin.
D, diplotin. D for dog.
D for dog, right?
Yes.
Is it D?
D. Yes. No.
All right, 4 points to you. You'll be going to name questions.
Five.
University of Ibadan, MSA.
Mr. Quizmaster, sir, again, the same thing has happened. We would have to disqualify the first 4 questions. I don't know if we
Yeah.
have enough questions for that.
Yeah, I know that already. That's what I'm asking. Your question, please.
Question 5 then. No, 5. We can't.
Your question from 5 to 10. Your
7.
question
Question
from
5.
5 to 10.
Wait. Sir?
Question 5, right?
Yes. Question 5.
Okay.
Windows on that complainer.
Mr. Quizmaster, you still haven't reduced the sidebar. Reduce the size of the sidebar. Please, let's do that before we go ahead to avoid any other mistakes.
Let's do question 7. That guy, he made the complaint that, and he now sent a file or something. Yeah.
He said the sub questions.
Sorry. I noticed a complaint sent to the comment section with the process. The image that was sent only shows the first 4 questions. 5 slides were showing, but the first slide was the cover slide. Only the first 4 questions were visible. 5 was not shown. You can refer to the image that he sent again to confirm. Only the first 4 questions were shown. The 5th question.
Okay, number 5, right?
Yes, sir.
What state in Nigeria has the highest number of local government?
Kano 44.
Kano 44. All right, that's correct. So your last question will be for NIMSA. UIMSA, your question, your last question. Name sir, 1 to 10.
Question 4.
Question 4.
We can see the screen, oh.
Yeah, I know you see number 1. It automatically count.
Okay. So we should choose another one. No, we put the screen on. Let's choose another. No, let's repeat it. Because I think it's the review, people reviewed, and I'm not 100% sure. It's the constitution. So stupid.
Okay, so 1 has been removed. So between 2 to 10.
7.
Eh?
Question 7. Question
Question
7.
7. Okay. During what administration did the Emerging Leaders Forum undergo a name change?
Sir, we can't see the question. Sir, the question, sorry, we can't. It's not changed on screen.
Oh, sorry. During what administration? Can you see it now?
Yes.
Yeah, during what administration did the Emerging Leaders Forum undergo a name change?
That's this previous one. Under Toborong Obot.
Wrong. Second attempt.
Eh?
Wrong.
Under Ibrahim Bello.
Wrong. The answer is under President Webster.
But Sir, no, that's Toborong Obot. She was under that was her administration. You are not specific.
UIMSA, please calm down. Please let me explain it to our quizmaster. Okay. So during the President Webster's administration was when it was changed. And it was during that time Torobong Obot was the director of the Emerging Leaders Forum. So in my judgment, I would say they got it right, but they did not say what we expected, but they still got it
and
right.
The question was saying that during what minister administration?
Administration is subjective. You could mean the Emerging Leaders Forum administration. That's what I took it as, or NIMSA's administration. We're mentioning the NETF. I was in the ELF forum directors. I thought that was what you meant. You did not say NIMSA administration. You would have said Webster.
And that means that you have to pick another question.
But it's correct.
We pick another question.
Oh, yeah. Question 8.
Question 8. All right.
There's no.
8. Our Shanono Foundation was created in honor of the Dutch president who died in active service and was created by world presidents. A44, D39, A34, D37.
39.
What did you say?
B39.
B was 39. All right. You are wrong. The answer is 30. C. The correct answer is C. 34. 39 president. So you have 0 points for the NIMSA question.
But we got the previous question. This one, but then.
So Good Dr. Anifa, you are done with University of Ibadan MSc. Dr.
Okay, yes, please, Master, I am here. Sorry for
Yeah.
that. All right, thank you. Thank you very much, sir. I would like us, before they leave, I would like us to go over their scores so they do not have any, just for clarifications. So from our quiz master who is keeping records of the scores, please can you give us the breakdown of the scores of UI MSA before they leave? So we have clarifications.
Okay, thank you, everyone. Thank you, UIMSA participants. So I will now be going through your scores, and I hope everyone listen attentively and I stand to be corrected if it is not like that. I hope you're also calculating, so let's go through it. At the end of anatomy, UIMSA has a total score of 0. At the end of biochemistry, they have score of 5. At the end of physiology, they have total score of 10. At the end of physics, they have total score of 5. At the end of biochemistry, they have total score of 5. At the end of chemistry, they have total score of 5. Current affairs, they have total score of 5. NIMSA general knowledge, they have total score of 0. And the total score is 35. Thank you. I hope you can cross-check your own if there is any misunderstanding, or if it is the calculation is not correct. Let me hear you.
Yes, the score is correct.
All right, thank you.
We complain too.
So, Dr. Anifa, I think you can allow them to go write their exam right now.
Yes, we can. UIMSA, thank you very much for joining this session. We wish you the very best in your exams and we wish you the very best in this quiz. All right, we can move ahead, Quizmaster.
Okay. So, I think, yeah. So I think I stopped at University of Abuja MSA. I think that was where we stopped.
Yes, we stopped at the second round of anatomy at the University of Abuja. So we are resuming with KUMSA.
KUMSA.
Second round of anatomy. Yes.
Okay.
Where are we choosing from?
Please, I'm calling out to share the screen. Okay, so Chukwuemeka Odumegwu, I'm only seeing just 2 of you. Where is the third person? I've been asking. Unmute your mic now. I said I'm only seeing just 2 of you.
The third person is here.
Okay.
Have you seen him?
Yeah, I've seen it. So from 5 to 20, your question.
What do you say?
Question 5 to 20. Pick your question from question 5 to 20.
19.
19 has been picked. Please pick another number.
14.
14. Okay. Okay. So, a 2-week-old woman, a 2-week-old baby who visited the pediatrician due to poor feeding and poor weight gain. On cardiac consultation, a continuous machine-like murmur is heard. An echocardiogram reveals a patent ductus arteriosus. If this structure had closed at birth, what would the remnant be called? A. Coronary sinus, B. Ligamentum arteriosum, C. Bulbus cordis, D. Ligamentum venosum.
B. Ligamentum arteriosum.
Ligamentum arteriosum is correct. So 5 points to Chukwuemeka of Dumegu University. So lastly, Ambrose Ali University. Your question. Ambrose Ali University.
Question 17.
Okay. Okay. A 49-year-old man is brought to the emergency department following a road traffic accident. He has sustained a blunt force trauma to the face, resulting in a fracture of the cruciform plate. The doctor explains to the patient that due to this fracture, he may have permanent nerve damage. What nerve is most likely affected by this fracture? And what clinical symptoms will he present with? A. Cranial nerve 1 and loss of smell. B. Cranial nerve 2 and ptosis. Sorry, cranial nerve 3 and ptosis. C. Cranial nerve 5 and loss of facial sensation. D. Cranial nerve 6 and horizontal diplopia.
Cranial nerve A, option A, cranial nerve 1 and loss of smell.
A.
Option
okay.
A.
Yeah, okay, olfactive nerve damage. Okay, that's correct. 5 points to Ambrose Ali University. So we'll be moving on to physiology. Okay, so physiology. Abubakar Tafawa Balewa University. Your question. Abubakar Tafawa Balewa University. From 1 to 20.
4, question 4.
Question 4. Okay.
Yes.
A 43-year-old lady is recovering on the intensive care unit following a Whipple's procedure. She has central venous line in situ. Each one of the following will lead to the wide descent on the waveform trace. A. Ventricular contraction. B. Emptying of the right atrium. C. Emptying of the right ventricle. D. Opening of the pulmonary valve. D. Cardiac tamponade. Single attempt.
Cardiac tamponade, D.
Okay, you are wrong. The answer is emptying of the right atrium. Federal University, Benin Kebbi.
Yes, sir.
Your question 1 to 20.
Question number 10.
Okay.
Question 5.
5. You said 10 before you. Are you picking 5 or 10?
Let's go with 5.
Question 5.
All right.
5.
A patient has a cardiac output of 6 liters per minute, heart rate of 60 beats per minute, and diastolic left ventricular volume is 200 ml. What is our left ventricular ejection fraction? A 15%, B 20%, C 25%, D 50%, E 75%.
25%.
Time up.
Your time is up. So the answer is D, 50%. No points to Federal University Benin Kebbi. University of Abuja, MSA.
Number 8.
Number 8, okay. Rose is a 34-year-old female who has been in a relationship for 4 years. Rose and her partner have been trying to conceive regularly for over a year without success. They have visited her GP to organize some investigations into a possible cause. Which hormone is released after ovulation occurs and can be used as a marker of fertility? A, luteinizing hormone, B, follicle stimulating hormone, C, estrogen, D, testosterone, E, progesterone.
Luteinizing hormone. Wrong.
Wrong. The answer is progesterone. So 0 points to University of Abuja, MSA. Chukwuemeka Odumegwu University.
Wrong.
Chukwuemeka Odumegwu.
We are here.
Your question 1 to 20.
Question 12.
Okay. A 23-year-old.
Sorry, we can't see your screen.
Sorry. Okay. A 23-year-old heart disease attends hospital for an intravenous infusion of desmopressin acetate. This acts by stimulating the release of von Willebrand factor from cells, which increases factor 8 and the formation of the platelet clotting. In patients without clotting pathologies, which of the following substances keeps the blood soluble and prevent platelet activation in normal conditions? A, erythropoietin, B, fibrinogen, C, prostacyclin, D, thromboxane. The patient has von Willebrand disease.
Thromboxane.
Thromboxane, the answer is wrong. The answer is C, prostacyclin. So, Ambrose Ali University, 13 has been removed because it has been shown on the slide. So, Ambrose Ali University, your question. Ambrose Ali University, your question. Ambrose Ali. Ambrose Ali University.
Question number 17. Number 17.
I did not. I'm just saying you now. You were muted before.
Question 17. 17.
All right. During pregnancy, the dash a uterine muscle enlarges due mainly to cell proliferation. B, uterus is quiescent under the onset of labor. C, breast enlarged due mainly to the action of prolactin. D, hematocrit rises. E, basal metabolic rate rises by more than 10%.
Breast due mainly to the action of prolactin. Option C.
Option C is wrong. The answer is C. Cellular metabolic rate rises by more than 3%. So 0 points to Ambrose Ali University. So to the second round of questions, Ambrose Ali, we are starting with you. Second round of questions for physiology.
Question 13.
Question 13. A 73-year-old lady is diagnosed with hyperaldosteronism for which of the following subgroups are those aldosterone released? A. Zonal fasciculatum of the adrenal gland. B. juxtaglottal apparatus of the kidney. C. Zonal reticularis of the adrenal gland. D. Adrenal medulla. E. Zonal glomerulosa of the adrenal cortex.
Zonal glomerulosa of adrenal cortex.
Excuse me, Quizmaster, sir. This
Yeah.
question was displayed earlier
Oh, yeah,
for a
that's
longer
good.
time, yes. So it
Thank
is
you
cancelled.
for reminding me. It has been cancelled. Please pick another question.
Question 15.
15. Okay.
15.
When measuring blood pressure by the auscultatory method, option A is B and E. B, the cuff pressure at which the first sounds are heard indicates systolic pressure. C, the cuff pressure at which the loudest sounds are heard indicates systolic pressure. D, systolic pressure estimations tend to be lower than those made by the palpatory method. E, wider calls are required for larger arms.
Option A, B and E.
Option A, B and E.
Option A.
Okay, yeah, that's correct. That's correct. A is correct. 5 points to Ambrose Ali University. Chukwuemeka Odumegwu University, your question.
20.
20. In the stomach, a pH rarely falls below 4.0. B, perisinogen is converted to penicillin by hydrochloric acid. C, ferrous iron is reduced to ferric iron by hydrochloric acid. D, acid secretion is inhibited by pentagastrin.
B.
B, right?
B, pepsinogen is converted to pepsin by HCl.
That's 5 points to Chukwuemeka Odumegwu University. University of Abuja, NSA. Your question. University of Abuja. Number what?
21.
21. No, it's just 20.
Oh, 19.
19. Okay. If the carotid and aortic chemoreceptors are denervated, A, increase alveolar PCO2 by 25% fails to stimulate ventilation. B, C and A. C, the relative ventilation rate is dependent by more than 40%. The ventilation does not increase during exercise. E, the ability to adapt to life at high altitude is impaired.
E.
What did you say?
E, option E.
Okay, E is correct. Point to University of Abuja, MSN. Federal University, Kebbi.
Question 16.
Question 16.
Yes.
It has, okay, 16. During pregnancy, there's an increase in A, maternal blood volume to twice the normal level. B, peripheral resistance. C, D and E. D, ligament laxity. E, maternal parathormone secretion.
A.
He said A, right?
Yes.
A is wrong. The answer is C. D and E, there is ligament laxity and the maternal parathormone secretion. In Abubakar Tafawa Balewa University.
Question 3.
Question 3. Okay. A 55-year-old man was admitted due to trauma at the trauma unit after being involved in a car crash. It is estimated that he has lost approximately 1,200 meters of blood. His observation are as follows: heart rate 125 beats per minute, blood pressure 12500 millimeter mercury. He is cold to church. What side of the cardiovascular system has contributed most to the blood pressure stability? A. Arteries, B. Arterioles, C. Capillary bed, D. Venous, E. Veins.
B. Arterioles.
B. Arterioles. Arterioles is correct. 5 points to Abubakar Tafawa Balewa University. So we'll be moving to physics, chemistry, biology. Then after that, physics, chemistry, biology, NIMSA, current affairs, and we'll cap everything with biochemistry. That will be the final section. So we're going to physics right now. So Abubakar Tafawa Balewa University, your question, physics 1 to 10.
5.
Question 5, okay. Five. What is the function of the Faraday cage? A, to store electrical energy. B, to shield from external electric field. C, to amplify magnetic fields. D, to generate static electricity. 10 seconds.
To generate static electricity. D.
Wrong. The answer is B, to shield from external electric fields. So 0 points to Abubakar Tafawa Balewa University. Federal University Benin Kebbi, your question.
Question 5.
Question 5. Okay. No, question 5 I just repeat.
Question 8.
8, okay. All right. Which process involves the transfer of heat due to motion of fluid particles?
Convection.
What did you say?
Convection.
Convection is correct. 5 points to Federal University Benin Kebbi. University of Abuja, MSA.
7.
7. All right. What is that efficiency of an engine operating between two each reservoirs at temperatures T1 and T2, where T1 is greater than T2? A, T1 to T2 greater, over T1. B, 1 minus T2 over T1. C, T1 over T1 minus T2. D, T1 minus T2 over T2. What did you say? B.
B.
Yeah, B is correct. 5 points to investors.
We have a physician here.
Chukwuemeka Odumegwu University. Chukwuemeka Odumegwu.
Number 1.
Number 1. Okay. What fundamental reason will you advance for critical angle to be particularly unattainable when a ray of light moves from water into glass? A, the light is from lower index of refraction to a medium of higher index of refraction. B, velocity of light in water is lower than the velocity of light in glass. C, the angle of refraction is not given. D, the angle of refraction increases as the angle of incidence increases.
A.
Option A is correct. 5 points to Chukwuemeka Odumegwu University. Ambrose Ali University, your question.
And it's very tough.
Ambrose Ali, please don't waste our time.
Question number 3.
3, right?
Yes.
In prism spectrometer, the lenses in collimator and telescope are converging lenses. B, the collimator is fixed, but the telescope and table can be rotated. C, the rays are viewed through the collimator. D, the telescope and table are fixed, but the collimator can be rotated.
C.
Option C is wrong. The answer is option B. Collimator is free, but the telescope and table can be rotated. So 0 points from Ambrose Ali University. So we'll be going to chemistry.
Physics, I remember. Please, why you go on your video?
Okay, so Ambrose Ali University, we are starting with you. Chemistry 1 to 10.
5.
7.
Okay.
5.
5. A reductive substance has a half-life of 6 months. 3/4 of the substance will decay in cases of heating.
Hey, please, 1/2 something. So if you have a half-life of 6, 3/4 of 6.
The time is up. The answer is going to be 12 months. So go to university.
Question 8.
Question 8.
If you don't know.
Elements present in the largest number of rocks and minerals. This so we can't hear you.
The element present in the largest number of rocks and minerals is 8.
Mr. Quizmaster,
Yeah.
the question has been for a long time before timing, so I think maybe we can change this question.
Yeah. What did you say before the time was up?
No, they didn't answer. You were not saying anything, so they were just looking at the question. So
all right. Please pick another question.
Question 12.
Question 12. Okay. Sorry, there's no question 12. Just have 1 to 10.
10.
10. Okay. What is the effect of mixing manganese dioxide with hydrogen peroxide? A. Manganese dioxide breaks down into manganese and oxygen. B. The hydrogen peroxide bleaching action is accelerated and increased. C. None of the above. D. Hydrogen peroxide breaks down into water and oxygen.
Wait, I think it's A. See answer. A. I'm saying B. Yeah, see.
B.
Time
Your
up.
option.
We said B. We said B before you said time
Your
up.
option is
No, it was time up before you said it.
Before you said time up.
That time is up. The option was wrong. The answer is D. The answer is D. So, University of Abuja, your question.
9.
9. How does common salt help in separating soap from solution after saponification? A, by decreasing the density of soap. B, by decreasing solubility of soap. C, by increasing the density of soap. D, by increasing the solubility of soap.
Quiz Master. Sorry, this question has been answered by UI for University of Ibadan. They answered this question.
Thank you. Please pick another question.
6.
What?
6.
6.
6.
Which type of glass is used for making glass reinforced plastic? A, fiber glass. B, quartz glass. C, flint glass. D, Pyrex glass.
Reinforced plastic. Pyrex glass.
Pyrex glass is wrong. The answer is A, fiber glass. Federal University beneath your question.
Question by 8.
8. It has been picked.
10.
10 has been picked.
Number 4.
Number 4, okay. In which industry potassium nitrate is used commercially? A, glass manufacturing. B, electroplating. C, firecracker manufacturing. D, leather industry.
Firecracker manufacturing.
Firecracker, no. Okay, yeah, you are right. Firecracker manufacturing is correct. I thought you said B, electroplating. So, 5 points to Federal University. Federal University Benin Kebbi. Am I right?
Yes.
Yeah, okay. So, Abubakar Tafawa Balewa.
Question 2.
Question 2. According to Central Pollution Control Board, particular size of dash micrometers or less in diameter are responsible for causing the greatest harm to human health. A, 0.5, B, 2.5, C, 5, D, 10.
B.
2.5 is correct. 5 points to Abubakar Tafawa Balewa University. So we'll be going to biology. So biology. Abubakar Tafawa Balewa University.
4.
1 to 10. What number?
Question 4.
Question 4. Okay. In paramission, the process of reconstruction of nuclei in a single individual which takes place without the fusion of gametic nuclei is known as A. Cytogamy, B. Automixis, C. Hemixis, D. Endomixis. What did you say?
B.
B. Wrong. The answer is endomixis. Federal University Benin, your question.
Question number 8.
Okay. This type of parenchyma is seen in tubers and rhizomes. A. Chlorenchyma, E. Erenchyma, C. Storage parenchyma, D. Water storage parenchyma.
A. Chlorenchyma.
No, the answer is C. Storage parenchyma. 0 points to Federal University Benin Kebbi. University of Abuja. No question.
10.
10. Spraying of phenylmercuric acetate (PMA) in plants causes A. Increases the rate of guttation, B. Increases the rate of transpiration, C. Decreases the rate of transpiration, D. Increases the rate of water absorption.
Decreases the rate of transpiration.
Oh, C, right? Decreases the rate of transpiration.
Yeah.
Is that what you said?
Yes.
Okay. 5 points to University of Abuja, MSA. Chukwuemeka Odumegu University.
Question 3.
Question 3. I'm not seeing you on the screen. No. Chukwuemeka Odumegu. Is anyone seeing them on the screen?
Why here?
Yeah.
All right. In the canal system, the structure is lined by choanocytes. This structure is particularly characteristic of the canal system. A. Asconoid type, B. Syconoid type, C. Leuconoid type, D. Syconoid and the Leuconoid type.
D.
No, the answer is A. Asconoid type. Ambrose Ali University.
Question 7.
Question 7. Okay. Double fertilization in angiosperms was discovered by A. Strasburger, B. Mashueri, C. J.C. Bose, D. Nawashin.
A. C.
Huh?
C.
Option C is wrong. The answer is Nawashin. So we have come to the end of biology. We're going to current. So, Abubakar Tafawa Balewa University, current affairs 1 to 10.
Question 2.
Question 2, okay.
Quizmaster sir, allow me interrupt. We have cancelled questions 1 to 4 for current affairs because they were shown partially on the screen.
Sorry.
So we only have 6 to 10.
Okay,
the exact number of the MSAs present.
Okay, so please pick from 6 to 10.
Question 8.
8, okay. Which 25-year-old was given an appointment as the chairman of the board of trustees of FEMA, the Federal Agency for Road and Maintenance Agency? His appointment was revoked within the Tinubu administration. A. Miriam Shetty, B. Ibrahim Kashimi, Imam Kashim Imam, C. Bida Professional, D. Alil Aliu.
Ibrahim Kashim, B.
Imam Kashim Imam. Yeah, that's correct. So, 5 points to Abubakar Tafawa Balewa University, Federal University, Benin Kebbi.
Question number 7.
Question number 7. Okay. Who is the current National Security Advisor in Nigeria? Who is the current National Security Advisor in Nigeria? Federal University, Benin Kebbi.
Time up.
Their time is up, and Malam Nuru Ribadu from Adamawa State. Okay, so University of Abuja MSc. Your question.
10.
10. Okay. Who is the new CBN governor? Who is the new CBN governor? University of Abuja.
Bala.
Dr. Oluyemi Michael.
Oh yeah. It's not Oluyemi. We got the Michael, but what's the surname?
Olayemi Michael. Dr. Olayemi Michael.
Yeah. The third name.
Oladipo.
No.
Olayemi Michael Kabusu.
Wrong. Your time is up. I'll give you instead of me giving you 5, I'll give you 2.
Sir, we got 2 names, right?
You got 2 names, sir.
It's Olayemi Michael Okadoso. So please, our score recorder 2 points for that. Chukwuemeka Odumegwu University.
Question 4.
Question 4.
There is no question 4. We only have 6 and 9.
Question 5.
6 and 9.
Okay, 6 and 9. Question 9.
Okay, all right. 9, Abi.
Yeah.
Who is the youngest ministerial appointment in President Bola Ahmed Tinubu's cabinet?
Ismail Kashim.
Wrong. The answer is the minister for, second attempt.
The Minister of Trustees and Boards.
No. The answer is Bosun Tijani. Minister for Communication. So, Ambrose Ali University for the last question in current affairs.
Question 6.
Question 1.
That's question 6. That should be the only question left now.
Okay, question 6. The second military coup d'etat in Nigeria took place on A. January 15, 1966, B. October 1, 1966, July 29, 1966, D. July 29, 1975, then February 13, 1976.
July.
What did you say?
1966.
July 1966.
Yes, July 29th, 1966.
Correct. 5 points to Ambrose Ali University. So we'll be moving to NIMSA question. Okay, so Ambrose Ali University will be starting. Okay, 1 to 10. 1 to 10.
Question 2.
Ambrose Ali, did you say question? Did you say question? Question 2, right? Right.
Sir, please, the screen is not showing.
Yes, I said, did you say question 2?
Yes, sir.
All right. Which NIMSA president was known as the pandemic president? A, the 44th NIMSA president. B, the 43rd NIMSA president. C, the 45th president. D, the 44th NIMSA president.
It's 40. B, 43rd.
Yeah, 43rd NIMSA president.
Thank you.
That's correct. 5 points. Chukwuemeka Odumegwu University, your question.
Question 4.
4, okay. Each of the following MSAs does not have a candidate for the position of the 42nd NIMSA president. A,
we can't see your screen, please. We can't see your screen, please.
Oh, sorry. Which of the following MSAs did not have a candidate for the position of the 47th NIMSA president? A,
resume, sir.
Okay, Rivers State University MSA. Okay, you are right. 5 points to Chukwuemeka Odumegwu University. University of Abuja.
Sorry, Quizmaster.
Yeah.
Before we proceed, please, I want to call the attention of the participants. At least, no matter how eager you are to answer the question, you should have allowed him to finish. You just interrupted him. Please, next time that will cause a penalty for any MSA that's repeating that again. Please be careful. Thank you.
Okay. Thank you, my Quizmaster. All right. University of Abuja MSA.
5.
5. After the General Assembly holding in Kano, the NIMSA presidency will be zoned to what region? A, Southwest.
We can't see
After the General Assembly holding in Kano, the NIMSA president will be zoned to what region? A, Southwest. B, Northeast. C, Southeast. D, Northwest.
Southwest.
Southwest?
Yes, Southwest.
Wrong. The answer is D, Northwest. No points to University of Abuja MSA. Federal University Benin Kebbi.
Question 2.
Question what?
2.
2. 2 has just been picked.
Question 7.
Okay. During what it has been picked? Pick another number. What did you say?
Numbers. Available numbers.
Number what?
Question 1.
1. Okay.
Question 1 has been picked too. It has been cancelled actually.
That help us.
Okay, the available questions are 6, 8, 9, and 10, I presume.
Yeah, 6, 8, 9, and 10.
Kuvimsa, please fix your network. You are breaking. We cannot hear you.
Question number 6.
Okay, 6. The NIMSA Emerging Leaders Forum was established in what year?
That's
correct. 2021 is correct. Abubakar Tafawa Balewa University.
8.
8. Okay. It has been picked.
7.
It has been picked.
3. 3.
Okay. All of the following are contesting for the position of the 47th NIMSA president, except A. Victoria Insadrian, B. Christopher Umo, C. Onwubuya Moses, D. Umo Anie Kana Basu. What's your answer?
C.
Time up.
Yeah, C is wrong. The answer is B. Christopher Umo. So the last session will be doing is biochemistry. Okay, so Abubakar Tafawa Balewa University. Your question 1 to 20.
Question 3.
Question what?
3.
Sorry, biochemistry is 1 to 19. Okay, so question 3, right?
Yes.
Which of the following compounds is a positive allosteric modifier of the enzyme pyruvate carboxylase? A. Biotin, B. Acetyl-CoA, C. Oxaloacetate, D. ATP. Abubakar Tafawa Balewa, your time is coming.
Time up.
A, we said.
What did you say?
We said A. You said A. By team.
They said A before you.
Yeah.
So 5 points to Abubakar Tafawa Balewa. Federal University of Benin, sorry, of Benin Kebbi. Your question, 1 to 19.
Question number 4.
Question number 4. Is it 4 or 5?
Let's go with 5.
All right. An essential amino acid in man is A. Proline, B. Threonine, C. Asparagine, D. Tyrosine.
As threonine. No.
Time up.
You picked threonine, right? So
Yes.
that's the correct answer. B. University of Abuja, MSA.
4.
What did you say?
4.
What did you say?
4. 4.
4. Fluoride reaction is specific for A. CON linkage, B. CSNH2 group, C. NH2 group, D. All of these.
A.
CONH linkage. All right. That's correct. 5 points to University of Abuja, MSC. Chukwuemeka Odumegwu University.
19.
19. RNA-directed DNA polymerase is 8. Replicase, B. Transcriptase, C. Reverse transcriptase, D. Polymerase 3.
Directed DNA polymerase.
Reverse transcriptase.
Reverse transcriptase is correct. 5 points to Chukwuemeka Odumegwu. Ambosali University.
Question number.
Question what?
Number 7.
Yeah?
Number 7.
Number 7. Okay. Nitrogen reaction gives a purple color and involves CO2 with A. Peptide bond, B. Histamine, C. Ergothioneine, D. Asparagine.
Peptide bonds. Option A.
Option what?
A.
A is wrong. The answer is
Option
D.
A.
I said A is wrong. That the answer is D. Asparagine. So 0 points to Ambosali University. Ambosali University, we are starting with you again for your second round of question. Question what?
11.
11. All of the following statements correctly describe ketone body.
I can't see the question.
The question is showing on the screen.
Okay, yeah.
The following statement correctly describes ketone bodies except A. They may result from starvation. B. They are present at high levels in uncontrolled diabetes. C. They include OH, B. Butyric acid, and acetone. D. They are utilized by the liver during long-term starvation.
Option D.
Option D, yes, that's correct. Utilized by the liver during long-time starvation. So, Chukwuemeka Odumegwu University, 5 points to Ambosali University for that question. Chukwuemeka Odumegwu University, your question.
Is there our question?
Yes, your question.
18.
18. In non-competitive enzyme activity inhibition, A. Increases the constant Km, B. Decreases Km, C. Does not affect Km, D. Increases Km. Km refers to the constant. And charismatic constant.
C.
What is it? C? Yeah. Is that C for cat?
Yes.
C is correct.
Sorry, Quizmaster. The first answer D, and it is a single attempt.
We answered C.
We answered only C.
We answered only C.
Sorry.
We answered only C.
We answered only C.
All right, that's correct. We are giving you the 5 points.
Thank you.
University of Abuja MSA, your question.
16.
16. In the biosynthesis of cortisol, the sequence of enzymes involved is dash. A hydroxylase, dihydrogenase plus isomerase hydroxylase. B dihydrogenase hydroxylase isomerase. C hydroxylase lyase dihydrogenase isomerase. D isomerase lyase hydrogenase dihydrogenase.
Dehydrogenase. B.
No, the answer is A. Hydroxylase dehydrogenase plus isomerase hydroxylase. The answer is A. Federal University Benin Kebbi.
Question 10.
Question 10.
I'm sorry, excuse me, Quizmaster. For the last question, what was the correct answer, please?
Correct answer was A.
All right, thank you.
Hypoglycemia depresses insulin secretion and thus increases the rate of A. hydrolysis, B. reduction, C. gluconeogenesis, D. respiratory acidosis.
C. Gluconeogenesis.
C is correct. 5 points to Federal University Benin Kebbi. And lastly, Abubakar Tafawa Balewa University. Your question.
Question 2.
Question 2. ATP is wasted in hyperphosphorylated cycle in RBC as otherwise it will inhibit A. Phosphoglutamate, B. Phosphoisoisomerase, C. Phosphoglucokinase, D. Phosphoenolpyruvate carboxykinase.
D, sir.
What did you say?
D.
D is wrong. The answer is C. Phosphofructose kinase. So with that, you have come to the end of this competition. So we wait for the time for our score recorder to collate all the scores. Once again, I want to appreciate all the participants, including the UIMSA participants that are writing their exams right now. Condition. And I also want to thank all of us for maintaining decorum throughout this competition.
Oh, all right. Thank you very much, Quizmaster, sir.
Sorry.
That was a hot one. Okay. Yeah. Physiology complaints. All right. Well done to all the MSAs so far. And we really commend you for your display of prowess in stuff and general knowledge. Well done to you. However, I am seeing we have one of our guest speakers with us here. I do not know, should we go ahead with having him give us a short speech, or let's address the question, the complaints we have first.
So we have
what are the complaints?
Right.
So Issa, I think this question was actually it was whether or not it was giving the wrong answer, they did not get it right. The question of who was the youngest ministerial appointment in this Bola Tinubu's administration. The actual answer is Betta Edu. And I do not recall the MSA getting it correctly.
Yeah, they didn't mention Betta Edu at all.
All right, so we move to the next. So Awumsa, please, what is the issue with your physiology complaint?
Okay, issue, we asked the question about what happens in pregnancy. There are two options. It's that prolactin increases the size of the breast in pregnancy, and that's correct. I'm not wrong. Another correct option was that the BMR increases by 10%. So that's the options in that patient. The patient that we picked up saying is also correct.
Okay, I think I have looked into that. Quizmaster, please, can you also look into it on your end? The question about during pregnancy, where the answer they chose was BMR increasing more than 10%. Okay, so I have lodged that with the Quizmaster. He's going to clarify for us. Thank you very much.
What did they pick? What did they pick?
Okay, they chose the option of prolactin. Prolactin increases breast enlargement. Okay, let's allow the Quizmaster do his research on that and he will get back to us. So, okay, the next complaint I am seeing here from Benedicta is that your answer got 2 out of 3 names. At least 3 marks should be awarded since no options were given. Well, to this, I believe the Quizmaster has made a fair judgment by even awarding them some marks out of the question. It's possible that there is another, what is the name of the person again? Please let me remember. There is another Olayemi somewhere in another governmental seat, and Olayemi Michael on another governmental seat, and he is not the CBN governor. So without the third name, there is really no way for us to differentiate. And let's be frank, it's the third name, it's the surname, or let me say the family name, that differentiates him and makes him unique. So I hope this answers the question. Yeah. All right, Quizmaster, over to you if you've been able to do the research on that particular question.
I'll still start with the basal metabolic rate increased by 10%. Breast enlargement is not, if a part of breast enlargement allergic to prolactin is not correct at all. It's not due to prolactin or no. It's more of progesterone, not prolactin.
Okay. So that has been cleared by the Quizmaster. I hope the air is clear. Okay. Even if you have any other observation, please type it in the chat box. We would like to give the microphone to our guest speaker in person of, okay, let's put it this way, the administration that brought the Emerging Leaders Forum into existence. Yes, the president of that administration, the 41st NIMSA president, who is in person of Dr. Umar Mohammed Dambuba, is here with us, and he would like to give us some goodwill message, just as he always does. Mr. President, sir, you have the microphone. Thank you very much. We are honored to have you. Okay, I think he is not available with us anymore. Perhaps a network issue. If he joins in later, we are going to give him the microphone to speak to us. So yes, well done so far to all the MSAs. This has been a hectic head-to-head good fight between the MSAs present here today. And well, let us allow some time for our second Quizmaster, who is keeping records of the scores, to finish the compilations and share the breakdown with us. Now is the time. Well, I don't know. Intensify your prayers, I guess. There's nothing God cannot do. Well done to us all. We have really done well. All right. Okay. Yes, we have one other of our invited guests on the call. I did not realize that earlier. We have the immediate past names, National Director for the Emerging Leaders Forum, person of Torobong Obot. She is here with us. Ms. Toro, please, if you are in a conducive environment, can you please unmute and give us a word or two? She's on transit, so that's why she has been texting in the chat since. So I'm not sure she will still be able to speak. People are on their way to the GA, the Kano Renaissance. All right. Unfortunately, she has left the meeting, so we won't be having her speak. Okay, somebody is bringing it to our notice, one of the audiences. Thank you very much, Isa, for bringing this. I would be reading it out, and I want to know if any other person also noticed this during the course of the quiz. Isa says it became apparent in the last question answered by ATBU, that's Abubakar Tafawa Balewa University, that they were checking something beside them to give an answer. I know they failed it, but they've been doing it. I do not trust them seriously. Okay, this is a very strong accusation. Please, who else noticed this? If you did, kindly raise your hand or type in the chat. Was this also noticed by anyone else?
A hand has been raised by University of Ibadan Medical Students Association.
Okay, University of Ibadan Medical Students Association, are you raising your hand in agreement with what Isa said, or you're raising your hand in response to another observation? I think you can unmute and speak. Our technical team, can we have participants on mute, or do they have to request? Okay, Muhyiddin Yunus is agreeing to that. Now we have two persons accusing ATBU participants of this. Let them provide an evidence. Okay. So, does anybody have anything else to say? Do we still have the hand up from your answer? No. Okay. All right. Yes, our technical team, let's just for confirmation, was the meeting being recorded? And will it be possible for us to go over the video again?
Yes, the meeting is currently being recorded.
Okay, so a video is going to show us the particular last question at ATBU answered.
It will take us a bit of the recording of the meeting, but yes, for transparency purposes, we were recording the grand finale.
All right. Okay, I think we'll have to put in a request for the recording, since we have these accusations and people are actually saying they saw it. All right. Isa, thank you very much for bringing that to our notice. It's being worked on by our technical team. Any other observations, please? It's really been a display of stuff. Excuse me, somebody trying to speak? Emmanuel, do you have something to say? Emmanuel, please, could you type in the chat box instead? We cannot hear you. Your network is breaking. Okay, you already even left. All right. Well done once more to all the participants. You guys have been amazing. You have been amazing. At first, I was scared when I saw the questions were more like clinical based. I'm like, okay, it's grand finale for a reason, right? Let's see who the stuffiest is. Okay. And yeah, I would like to point out, as the chief of staff for NIMSA Emerging Leaders Forum and the head of planning team for this quiz, I would like to say that if we all notice, the way and pattern this quiz went is quite different from the first version that I held last year. And well, there is always improvement in every. Okay, there is always improvement in every, rebirth of any particular program. I would want to call our attention to the fact that this year, due to the fact that we had a knockout stage, a final stage, and then, another grand finale, gives more opportunity for us to be exposed to more questions, more variety of questions, across the different sections that the quiz was done, across anatomy, across biology, across physiology, physics, biochemistry, chemistry, NIMSA knowledge especially, and then the Nigerian current affairs. I agree. I would understand that, okay, it's tough banter. It's meant to be academics alone. But the fact that we brought in these other two sections to test our knowledge on whether or not we know what's going on around us, it's quite a disappointment that if we asked any random question about our country, we don't even know it. And that was why at the beginning we started with regional current affairs. Okay, know something about your region, something peculiar about your region. I think at the Northwest regional finals, there was a question about the oldest building in Kano. That's actually something everybody is meant to know, but then we did not know it. And funnily, it's currently the Emir's Palace. So wow, how come we don't know that the Emir of Kano's palace is the oldest building in Kano? Wow. So I want us all to take this as a challenge to stay up to date regarding the affairs of our country, regarding the affairs of our organization, NIMSA, to stay up to date and to just be current, because I don't know, anything can happen and they ask you one thing and then you just go blank. I really do not see this so far in my experience. I do not see this traits in people from other countries that I have met. They know things about their country that even I myself don't know the equivalent in my own country. So please, let's all take it as a challenge to stay up to date and be current. All right, I think our quiz master is done with the collation of results. I'm sorry if it's taking so long. She needs to be very thorough with it so we don't have any complaints. We need to be as transparent and as possible as we can. Madam Director, do we have Dr. Dambuba back with us?
Yes, we do, Hanifa.
All right. Dr. Omar Dambuba, please, you have the microphone. We've been expecting you. We can't wait to hear what you have for us. Thank you, sir.
Thank you. Can you hear me, please? Am I audible?
Yes, you are audible, sir. We can hear you loud and clear.
Okay, thank you very much. I'm sorry for, you called upon. My network was bad. I'm on transit too, so I just went up. Thank you very much, the Chief of Staff, and for moderating this excellent quiz competition. We are really proud of you, the judges, the impartial judges, and all others that are present. Distinguished and respected ladies and gentlemen, as we come to the final lap of the preclinical quiz competition, it is a victory in itself that we are seeing this program to this momentous end. That we are here today is a victory for the Emerging Leaders Forum and the Nigerian Medical Students Association as a whole. It is a testament to what people can do when they come together for the greater good. I will have used the word icon to describe Madam Director, but she is beyond that. She's an institution in the leadership space, a national treasure, and you are Emerging Leaders' pride and a beacon to NIMSA. It is truly an honor to be here today at this grand finale of the NIMSA Emerging Leaders Forum and National Preclinical Quiz Competition. Years ago, we initiated the Emerging Leaders Forum with a vision to empower and nurture the incredible talents within our medical students community. As I look around this place, I am filled with pride and joy to share stage with individuals who have been the former Emerging Leaders directors. Seeing their accomplishments and the positive impacts you have all made to the test is a testament to the incredible potential within our NIMSA family. When I saw the flyer with Ibrahim Mohammed Bello and Torobong, who was the Ibrahim Bello was the pioneer director when I was a president, and Torobong was his deputy then. A year after Torobong took over the baton of responsibility, and she has done excellently well, improved on what they have done. And now Aisha Dambata. I think there is no consistent organization that have produced competent leaders worthy of emulation like the Emerging Leaders Forum. I want to extend my heartfelt congratulations to each participant of this top banter National Preclinical Quiz Competition. Your dedication to knowledge and excellence is commendable, and I am confident that you represent the bright future of medicine. A special shout out goes to the current director. Yeah, I have said that, for our outstanding leadership, steering the ship and continuing the legacy of the NIMSA Emerging Leaders Forum. Your commitment to empowering the younger generation is truly inspiring. Today, as we celebrate the achievement of these young leaders and brilliant minds, let us reaffirm our collective commitments to fostering a community that thrives on mentorship, collaboration, and continuous learning. The journey of becoming exceptional medical professionals is one that we undertake together. As a president, I've traveled the length and breadth of this country, and I've been amazed by the talent and the capacity and the dogged determination and the resilience of medical students. The abundance of these qualities among our people assures us that if the leadership of the association lives up to its responsibility, our people are ready to do the rest. So we must live up to our responsibilities. There is no other option. I've met and established a genuine bond of brotherhood with some of the most amazing human beings here, and together we have shared experience that strengthen our bonds. Student unionism is an unfinished story, a long tale of promise and a peril, and our final chapters have not yet been written yet. I am more confident that our best days are ahead and that we can build a future where our association is a beacon of excellence. Doing the impossible is the history of the Nigerian Medical Students Association. Thank you all for being part of this incredible journey, and here's to a bright future of NIMSA and the emerging leaders who will shape the landscape of the healthcare in Nigeria. Congratulations to everyone, and may the spirit of empowerment continue to flourish within our NIMSA family. I wish you a happy General Assembly. Long live Emerging Leaders Forum, and long live the Federal Republic of Nigeria. Thank you, and God bless you.
Thank you very much, sir. I think our appreciation has to come all the way from 2021 when the Emerging Leaders Forum came to being till now, because the forum has really impacted so many lives since then. And personally, I would say I'm a living testimony of that. From attending the first NIMSA Health Summit in Abuja in 2021 and meeting Torobong. And at the time, Mustapha Tukur of blessed memory. Then in 2022, by being the campus representative of my school under the Emerging Leaders Forum, and now 2023 has been to being the chief of staff of the NIMSA Emerging Leaders Forum. Well, I would say what a journey I have come, and if not because of the Emerging Leaders Forum, which I had that understood the fact that, okay, I am a novice, I am still in 100 level, I am still in 200 level, I'm still trying to grasp things, and I have the room to make mistakes, I have the room to grow and to find myself. So really, we appreciate you for all you have done so far, and the fact that you never left us for a second. Since 2021, you've all attended almost all of our national programs ever, and you always show up. So thank you so much. And I really hope, as I have a testimony of the NIMSA Emerging Leaders Forum, every other preclinical student here present will also be able to give a testimony of their own success too from the forum. Thank you so much, sir, and we really appreciate you. We are honored to have you. Okay, so I think I'll be handing over to our quizmaster. The results are ready for her to give us a breakdown of all of them, and then from there we proceed. Thank you. Khadija Garba, you have the microphone, please.
All right, thank you, ma'am. A lot has been said, and I want to congratulate all the MSs. They did very well, excellently well, trying to compete against other counterparts from other universities from different parts of Nigeria. So the results will be broken down as the different sections that were taken. And as I have mentioned, University of Ibadan, I don't think there is another need to go through their breakdown again, but I will repeat their total score for University of Ibadan as total score of 35 marks. So I will go to Atbumsa. At Bumsa, during anatomy session, they have total score of 5 marks. During biology, they have total score of 0. Physiology, they have total score of 5 marks. Physics, they have total score of 0. Biochemistry, they have total score of 5 marks. Chemistry, they have total score of 5 marks. Current affairs, they have total score of 5 marks. And NIMSA knowledge, they have total score of 0. So making it total of 25 marks. Can I go on? Am I audible?
Yes, ma. Yes, ma.
All right. Then Federal University Birin Kebbi Medical Student Association. At the end of anatomy session, they have total score of 10 marks. Biology, they have total score of 0. Physiology, they have total score of 0. Physics, they have total score of 5 marks. Biochemistry, they have total score of 10 marks. Chemistry, they have total score of 5 marks. Current affairs, they have total score of 0. NIMSA knowledge, they have total score of 5 marks, making total of 35 marks. University of Abuja, after anatomy, they have total score of 5 marks. Biology, they have total score of 5 marks. Physiology, they have total score of 5 marks. Physics, they have 5 marks. Biochemistry, they have total score of 5 marks. Chemistry, they have total score of 0. Current affairs, they have total score of 2. NIMSA knowledge, they have total score of 0, making their total score 27 marks. Chukwuemeka University, yes? Hello, you're saying? Can I go on? Can anyone hear me?
Yes, we can hear you. Continue.
Okay, right. For Chukwuemeka, they have after anatomy, they have total score of 5 marks. Biology, they have total score of 0. Physiology, they have total score of 5 marks. Physics, they have 5 marks. Biochemistry, they have total score of 10 marks. Chemistry, they have score of 0. Current affairs, they have total score of 0. And NIMSA, they have 5 marks, making total score of 30 marks.
You can just call them Basa. We can just one round, so we just break the tie, and that will be all.
I didn't understand.
Yeah, sorry, Khadija, please I did not hear what you said.
About what?
Your last statement. You were reading out this course.
Yes.
Yeah. Okay, which school was that?
The one I just finished is it the Chukwuemeka University
Yeah,
Medical
the
School?
Chukwuemeka, yeah.
Yes. You didn't get it?
Yo, like, what's their total score?
Okay, their total score is 30 marks.
30, okay, please continue.
All right, for Ambrose Ali, anatomy, they have total score of 10 marks. Biology, they have total score of 0. Physiology, they have 5 marks. Physics, they have 0 marks. Biochemistry, they have 5 marks. Chemistry, they have 0. Current affairs and NIMSA, they have 10 marks. So they also have total score of 30. So at the end of the day, University of Ibadan and Federal University Birnin Kebbi, they have total score of 35 marks together. And also Ambrose Ali University and together with Chukwuemeka University, they have total score of 30 marks also. Then followed by University of Abuja with total score of 27, and then at BUMSA with total score of 25. I stand to be corrected if I'm not right. Thank you.
Okay, so please, Abubakar Tafawa Balewa had total of 25, right?
Yes.
What about Federal University Birnin Kebbi?
They have total score of 35 marks.
35, okay. So that means that we have two ties, four schools that are tying.
Yes.
UI and Abubakar Tafawa Balewa. Then
No, it is UI and Federal University Birnin Kebbi that they have tie of 35 marks.
Yes.
Yes. And then Chukwuemeka and Ambrose Ali with 30 marks.
Okay, 30 marks. Okay.
Yes. Then University of Abuja, 27 marks. And at BUMSA, 25 marks.
25 marks. Okay.
Thank you.
Okay, so we have a tie between before I continue, UIMSA, are you here?
Yes, sir, we're present now. All three of us.
You are present, the three of you. Okay, you are done with the exam. Okay. So what I'll do is first take the 2 schools that have the 35 points, and I'll now take the next 2 schools with the 30 points. That's where I'll do it. Next, University of Ibadan, MSA, and Federal University Birnin Kebbi. I'm going to be starting with you guys. So I'll be giving a round of questions. I won't project the questions. Okay, but I might project I will project the questions actually. So because all the questions have options. So you'll be able to see it and you answer within 10 seconds. So I think we'll be starting. You'll be using, you use physiology questions to break the tie. So using physiology questions to break the tie. So UIMSA and Federal University Birnin Kebbi, hope you heard what I said.
Yes, sir.
All right.
Yes, sir. Yes, sir.
We'll be starting very soon. University of Ibadan, MSA, are you ready?
Yes, sir.
Okay, all right. So we'll be starting now.
Are we picking or is it just
asking? Okay. All right. Hope you can see the question.
Yes, sir.
Yeah. A patient is diagnosed of a first-degree heart block, which is shown on its ECG by an elongated PR interval. The PR interval relates to a particular period in the electrical conductance of the heart. Each of these will cause the PR interval to decrease. A, increase the conductance of the atrium. B, decrease conduction velocity of the SA node. C, increase conduction velocity across the AV node. D, increase hyperpolarization in the cardiac action potential. You have 10 seconds.
D, increase hyperpolarization in cardiac action potential.
No, that's wrong. The answer is B, decrease conduction velocity of the SA node. So that's the only thing that can cause decrease in the short PR interval, like your Wolff-Parkinson-White syndrome and Longano-Lewin. So 0 points to University of Ibadan, MSA.
Sorry, Quizmaster, if I may be permitted to interrupt.
Yeah, okay.
After a few consultations with regards to complaints in the comment section from Ambrose Ali University Medical Students Association, we consulted a couple of resources, and it would appear that the initial question that they answered does have two answers. Prolactin increases the size of breasts, increases the breast size in pregnancy, and the answer provided by the Quizmaster also increases breast size in pregnancy. For that reason, it would appear that the question that Ambrose Ali answered had two answers in the option. With that, we are suggesting that Ambrose Ali be given a new question, same way that was done for University of Ibadan in their NIMSA question, where there were two potential answers. Should Ambrose Ali University get this question that is going to replace the problematic question, then they will join Federal University Birnin Kebbi and University of Ibadan Medical Students Association in the tiebreaker for first place. Should they fail it, then they remain in their position as uncontested third place. I'm so sorry for the interruption, but this is in the interest of providing a fair competition for all MSCs present.
That means I'll have to go back to attend to Ambrose Ali.
We are deeply sorry, but in the interest of fairness, prolactin is a factor that increases breast size in pregnancy, and as such, there were two answers to that question. And if we should give them the same courtesy that University of Ibadan was shown, then Ambrose Ali should be given another question. If they get it, then they join Northwest and Southwest in the tiebreaker. If they do not, then they retain their third position.
And what I'll just do is, let me just finish this one round of questions with you and Sibumsa. I will attend to AAU after that. Please.
All right, then. Thank you, Quizmaster.
Okay, so Federal University Birnin Kebbi. This is your question. So, question number 1. So, Federal University Birnin Kebbi, hope you are seeing the screen.
Yes, sir.
You are seeing the screen, right? So, sorry, I'm not seeing the upper part, but I just continue for he receives a 3 minutes of CPR and has return of spontaneous circulation following this. Following admission to the hospital, he undergoes genetic testing, which reveals a genetic condition causing cardiac muscle hypertrophy, involving a mutation of the gene involved in the production of troponin C. What is the function of the protein involved in this patient condition? A, binds to actin in thin filament to help contract cardiac muscle. B, binds to calcium ions resulting in conformational change to the protein complex. C, binds to myosin to help contract cardiac muscle. D, binds to promyosin to help contract cardiac muscle. So which of the options is correct?
B, sir.
What did you say?
B.
Okay, yeah, B is correct. All right. So, Ambrose Ali University, because there are no ample of options there, so I'll be the one to pick. I'll be the one to pick the questions for you. Ambrose Ali University.
Yeah, yes, sir.
Because there are no ample of questions left. Pick from. Okay, I will select. I will look to the questions that are remaining.
Okay, now no problem.
Okay. We have 9, 10, 11, 14, 19. 1. 9, 10, 11, 14, 19.
Question 11.
Okay. Which one of the following hormones is mainly responsible for sodium change in the sperm ducts? A. Vasopressin, B. Angiotensin 1, C. Aldosterone, D. Somatostatin, E. Cholecystokinin.
Aldosterone C.
What did you say?
Aldosterone C.
So aldosterone is correct. All right. So that means that Ambrose Ali, you have 35 points. So that means that Chukwuemeka Odumegwu University will be joining us in the tie. So that means that the tie is with 3 schools. Federal University Benin Kebbi, University of Ibadan MSA, and Ambrose Ali University. So Ambrose Ali University, you'll be answering your tie questions now.
Which questions are we to pick, sir?
I'll be the one to give you. As you see, I'll be the one to give you. Yeah. So, this is your question. A pregnant woman attends a routine appointment where a doctor explains the normal physiological changes in pregnancy. Which of the following clinical features will be considered abnormal in pregnancy? A. Increased tidal volume. B. Increased respiratory rate. C. Constipation. D. Increase or decrease in micturition rate. E. Increased stroke volume.
Constipation.
Did you say constipation?
Yes, sir.
That's wrong. The answer is increased respiratory rate. That's wrong. Okay. So, Dr. Anifa, do you want us to go one more round? Because I feel the first round of questions as okay, I said because Federal University of Benin Kebbi, they are 40 points. Okay, so the tie left is between University of Ibadan MSA and Ambrose Ali University. To help us know who is going to be the second and third.
All right, so Federal University Benin Kebbi has won first place. Congratulations to Fubimsa. So yes, I think we should continue to break the tie between Ambrose Ali and University of Ibadan MSA.
All right, thank you.
Thank you.
So
sorry, sir. You have a complaint. Our hands have been up for a while. No one has responded.
What complaint is that? Please, I'm listening.
Concerning our question, the question said a first degree block, which I know is usually containing the AV node. And the answer you selected was relating to an
Excuse me, did you read the question? The question said, what condition will lead to a decrease in the PR interval? In first degree AV block, there is usually a prolonged PR interval, isn't it?
Yes.
And the question is asking you, what will cause a decrease in the PR interval? Are you getting what I'm trying to say? So the question is basically asking you, what are the things that will cause a decrease or a short PR interval? And there are only two things. Which are your Wolf Parkinson White and Longano-Lewin. That are the things that cause a short PR interval.
Sorry, I'm not getting what you're saying. Can the question projected again, please, so that I can see?
Right.
Because
I'll project it for you. Don't worry.
Thank you.
All right. So this is the question. A patient can see the question. The question is asking you, which of the following could cause the PR interval to be decreased?
I thought first, second, and third degree blocks are relating to the AV node, MOBITs.
Yeah, they are relating to the AV node, yes, of course.
But the option B you picked as the correct answer is decreased conduction velocity of the SA node. Meanwhile, increased hyperpolarization of cardiac action potential can also cause an increased PR interval.
Increased hyperpolarization in the cardiac action can also cause an increased what?
An increased PR interval, yes, sir.
But I won't still give it to you.
Sir, please confirm, please, because I'm very sure that SA node has nothing to do with degree block, sir. MOBITs type 1, type 2A, type 2B, type 3.
And type 2B and the third degree heart block.
Yes, sir. They don't have anything to do with the SA node.
Because everything has to do with it. In the third degree heart block, we have the AV nodal dissociation, isn't it?
Yes, sir.
Well, okay, I will confirm and check. But if you miss it, I will deduct more mark.
Sir?
I said I will reconfirm and check your question.
Please do, sir. Thank you, sir.
So, UIMSA, I'm going to continue with you.
Sir?
UIMSA, I'll leave and now the second to break the questions to break the second and the third time.
I can't hear you, sir.
Sir, we can't hear you.
I'm saying that I will look at that, but I'll continue with the questions to break the time.
Okay, no problem, sir.
Ambrose Ali University. I'll go back to look at that.
Okay, sir.
Hello, good evening.
Okay. University of Ibadan, MSA. Your question.
Yes, sir.
The three vitamins which are specifically required for proper nerve functions are A, thiamine, niacin, and riboflavin; B, thiamine, folic acid, choline; C, thiamine, riboflavin, pantothenic acid; D, thiamine, pyridoxine, vitamin B12.
A.
A, wrong. The answer is D, thiamine, pyridoxine, vitamin B12. Because you are wrong. And don't go and contest it because there's nothing you want to convince me about this. Because
No, I was not sure of the answer there. I'm not testing it.
Yeah, because you know that thiamine is important. Pyridoxine, of course, B6 is important for nerve function and your vitamin B12. So you are wrong about this. But I'll still go back to your other question to confirm. So,
Quizmaster, please, can we get an update now? That means first place still stands as Federal University Burning Kebbi, yes?
Burning Kebbi, yes, and you still have a tie between UI and Ambrose and University that I want to break. But
Thank you very much.
Okay, yes, that's if University of Ibadan, if I cross-check the question that they said they missed and they are right, that means Kebbi, Benin Kebbi and UI will still be tying currently. So, well, let's see whether that will change if Ambrose Ali gets that question. Ambrose Ali, phosphoribosine, pyrophosphate, glutamine amido transferase. The first enzyme immediately committed to this synthesis is feedback is inhibited by A, AMP, B, IMP, C, XMP, xanthone monophosphate, then C, AMP. What's the answer?
AMP.
Yeah, AMP is correct. AMP is correct. Now I want to confirm you guys' answer. University of Ibadan, MSA. University of Ibadan, MSA. UI.
UIMSA,
Yes, sir.
please, if you are here, kindly respond.
Now, to your question, you said that first
Yes,
degree
sir.
or PR interval does not have anything to do with the essay note.
Yes, sir.
Is it that what you said?
Yes, sir.
But I'd like to tell you, because two waves are involved. The P wave starts from where?
The P wave is relating to the contract and the polarization of the atria.
Yeah, the atria. Doesn't that determine what the sinus region will be? And is it not the SA node that will start that?
Oh no, sir. What I'm saying is that it has passed through the SA node. Is the SA node is the pacemaker now? So the origin of the depolarization is coming from the SA node. So it goes to the AV node. Like blocks are blocks. You can check it any resource. I just even checked it now. Blocks are relating to the AV node because the SA node is the pacemaker. So you can't have a block at the pacemaker. You can only have a block after you have started the depolarization wave.
Yes, the question is not saying that what will now cause a decrease in the PR interval. So if there is a decrease in the conduction that is going to pick from the won't that cause the PR interval to decrease? It's not because you are saying the first degree has loss only at the atrioventricular node. It is not. It starts from somewhere. You can't neglect where that one starts from. You can't just narrow your mind to the atrioventricular node alone. No. The PR interval starts from the beginning from P wave down to the beginning of the QRS complex, isn't it? And so you can't neglect where that wave, where the pulses are generated, where it's coming from. So first, the degree of bulk is not related to the atrioventricular node alone. So the notion is wrong.
Quiz master, please, what is your final decision about this question? Is it right or wrong?
I'm still sticking to the option B.
Okay, then the quiz master's decision should be respected, please. So please, University of Ibadan, your answer is wrong. And let us move on.
Please wait, just calm down. Yes, quiz master decision is final. Yes, I know, but we are also in a learning academic environment. I'm just trying to explain to him that I should go back and try to understand what the first degree, what the hard is, and it should relate to that question. I will still in my mind. I just have a conversation.
This thing is breaking.
Knowledge. I'm just trying to explain to him that you are still wrong, but I'm not going to change my mind in instance. So UIMSA, the group rep. So I want you to go back and read up on those the hard blocks.
Wait, AV block. Hard block is AV block now. Everyone knows that.
Yes, everybody knows that. And okay, because you are saying you are trying to say it's AV node, but you don't. The SA node is it not in the atria?
Like the SA node option there was a trick question. It was a trick option because they feel that people know that blocks usually decrease conduction, but the AV block, heart block is like you can check it anyway. Heart block is synonymous to AV blocks, and high polarization can also decrease.
I know.
So is D a potential? Because I think we're ignoring the D option. Is D not a potential answer too?
No, D isn't. D isn't at all. D isn't a potential answer. D isn't a potential answer at all.
Okay. Is AV node now? You can check any resource. Like It's something I read like recently.
And
So
please,
I'm not
University of
down. I'm not
Ibadan,
down.
please, University of Ibadan,
University of
please.
Ibadan insists the answer is C.
Elongation is
I
literally
think
correct.
it's literally correct. See, don't you speak it.
University of Ibadan, please let us
We are not
have.
arguing anymore. We rest our case.
But you insisted the option was C.
No. We never
The
said.
option was D. That
All right.
decrease in cardiac potential will lead to hyperpolarization. Is that what you picked?
Thank you.
Yes,
University of
GDD. I didn't see anything that was like I was quite certain that it's not increased in conduction, definitely. So C was out of it. I think H was out of it. Then I was thinking the B was going to be AV node because that's what the legit definition of node type 1, which is heart stop, first heart stop.
Narrow your mind to that.
Sir?
But because you put your mind that you get an open mind. But D, if you look at it, D is also not a potential option because you are not looking at it well. It's not a potential option. So option B is still the correct answer.
I don't think I can argue further because
Quiz master, please.
Yes,
Can I say
the
something?
decision is final. Yes, of course.
Yes.
And with
So
that,
thank you so much, Quiz master.
Second, and University of Ibadan MSA is third. But my colleagues from University of Ibadan MSA just back and read.
Thank you so much, Quiz master. And I think for many of us, this is not the first time we are joining any quiz competition, and we have been participating for a long time also. So for my view is that for this thing, University of Ibadan, the way you are arguing with the quiz master, actually it wasn't a nice way. And I think for the quiz, personally, I have attended, arguing with your quiz master usually costs you penalty, or it will cost you some marks. So as far as I'm concerned, you should personally apologize to the quiz master for what you have been doing. This thing, the quiz master's decision is always final, but you have been arguing with him. For what reason? That was not nice at all.
Please don't remove their marks.
No, I'm telling them, no, this wasn't stated initially as part of the rules, so there is no any deduction that will be done. But I'm telling them so that they will be cautious when going to any other quiz in any other place next time, because they may deduct some marks from what you have already earned earlier. And so please, I want you to personally apologize to the quiz master, because he has been patient, lenient, and trying to be very fair with each and every MSc so far. It wasn't nice. At least if he is not even right, he is your senior for God's sake in the first place too, and he has been selected because of academic excellence and his experience toward this. But the way you are arguing, truly it wasn't a nice way. Thank you.
Sorry, I did not know it came off Labi. I had no intention of making it seem like an argument. Well, I was just trying to get clarification. I already surrendered that I was not going to argue the point, but he asked me to state my point. I didn't mean it. I apologize to the quiz master. I promise that moving forward in any other quiz competition, we will not have a repeat.
I apologize. I know. Once you know something, yes, and somebody is telling you, I'm not sure. That's why I was just trying to have a conversation with you. I know my co-colleague wants to go but sometimes you need to just have a conversation and just know and just have exchange of minds. As nobody is an island of knowledge. That's why I'm also going back to check whether whatever you said was wrong. But I'm sure that D that you picked, just look, I know he's not just the right, it's not even a potential option. It's not even a potential option at all. Option B and C probably be okay. Those something were close to the answers, which you did not pick. So, but all right, all well and good. I guess we have come to the end of this competition. Congratulations to all the participants. Everybody is a winner. And I want to wish everybody good luck in other quiz competitions. It has been a stressful day, so you should go home and just relax. It has been a nice journey from Saturday down till Saturday, Tuesday, and today. And I hope everybody has learned one or two things on the journey. I wish everybody well. Goodbye from the Quizmaster. I hand over to Dr. Hanifa to continue to moderate about the quiz, since we know our winners already. Federal University of Benin Kebbi, well done and well. Thank you very much.
Comes a lady complaint in the complaint box, and you guys ignored us. It's not looking fair. It's not looking fair at all. We laid it earlier after the first quiz. It's not looking fair.
Good evening, Comsa. Good evening, Comsa. I made note of your complaint in the comment section. As you're very well aware, even in the first place, when an MSc had a similar issue, when a number of us contested to the fact that they had spoken before the time up marker was called, their marks were awarded to them. Unfortunately, the same cannot be said for your situation. The other complaints that have been addressed this evening are complaints that are not in any way related to the similar complaints that you are bringing up. They are complaints being raised towards the validity of the question. At this moment, I apologize, but the Quizmaster say is final, and the call for time up was heard before your answer was heard, and as such, we cannot reconsider your question.
No, we answered the first. I'm so sorry to interrupt you. We answered the first one correctly. Then Lady Khadija said time up. Then another of our
you said A. You said A before C.
He now said another wrong answer. They now said we gave two answers, so they cannot pick.
I remember that very clearly. But if you do remember the rules that the Quizmaster gave,
single attempt question, A was wrong.
Yes, it was time up. Now,
the Quizmaster said
the other question was not meant to be considered.
No, the Quizmaster said there can only be one attempt for the multiple choice question.
That was the wrong answer, by the way. So you're not right to the first instance.
We got the answer correctly, and she said it was time up. Then
it was not even the correct.
No, Koumsa, I remember the question very clearly. You gave A as your first option, and then you changed it.
The recording. But can we revisit the recording? Let's see how it happens.
Yes. For Koumsa, I will personally send you a footage.
It's looking so unfair for Koumsa.
Koumsa, I will personally send you a footage of the
everybody complains.
Koumsa.
Our complaint was just ignored. This is looking unfair for Koumsa.
If you are not careful, I'll deduct more marks from you if you are not careful.
Koumsa.
You all listen to the rules. All the multiple choice questions is one attempt. It's one attempt to answer. And your first attempt, which was the only attempt you have, was the wrong option. And you said A, and I told you wrong. You now said the correct answer, which was C. That was the rule. Only one attempt, and the first attempt was the wrong answer. And I said no points. So there's nothing to what you are saying. Nobody is unfair to anybody here. So I think we have solved that. Please, you can send the recording to them. Let them see their error by themselves. Let them see their error by themselves. So once they see their error, I'm very sure they will have a change of heart. Thank you.
Thank you very much to our Quizmaster. Thank you so much to all MSA quiz teams that stayed till the end. Our second Quizmaster for the day, you've done an amazing job and we appreciate you. So our moderator, Hanifa, the Chief of Staff, and the Program Coordinator for the preclinical quiz competition and stuff banter, an amazing job. It's been a long journey and we're finally at the end. Congratulations to all of our 6 finalists. One special congratulations to our winners. First place, the Northwest Region, Federal University, Benin Kebbi. Excellent and amazing fit. You have done amazingly. Congratulations to FUBIMSA. And to our runners up, to our runners up, FUBIMSA and AUMSA, congratulations. You all have done excellently. You have done an amazing job and we applaud your stuff. We applaud your courage in representing your MSAs on this stage. We'd like to thank you for staying with us thus far. It's been an experience being with you. And we're all human. There are times that we may be wrong. We cannot always get it right. But I believe to the best of our abilities, the Executive Council of the NIMSA Emerging Leaders Forum has done its best to provide as fair a competition as we can. So I'd like to appreciate my team for pulling off this feat. Once again, thank you all. Congratulations. And as an announcement, the award and prize giving ceremony of the National Quiz Competition will be holding physically at the GA in Kano by tomorrow, together with the NMA quiz. Congratulations. Should in case any of the participants are not physically present in Kano, your MSA president will be receiving your awards on your behalf. Congratulations, and it was amazing being on this journey with you all. Thank you so much.
Ma, please, we
I believe some MSAs are requesting for it. So please, a written report of this scores for the requesting MSAs. Thank you so much.
And a flyer to show that we're the winner.
Yes.
Flyer to show that Fubimsa is the winner. So I will show all our seniors.
All right, Fubimsa, it's your day. Take your flowers. Congratulations.
Yes, thank you. Thank you.
Thank you so much. I believe we can call it a night. Once again, congratulations to the winners. The typed up results will be sent for your posting pleasures. Federal University Birnin Kebbi Medical Students Association. Congratulations to our national champions. Congratulations to our runner-ups. You've been amazing. Thank you for joining us. It's been an experience. Good night, and wishing you the most eventful and exciting GA in Kano. Good night.